So hey everyone, welcome to Core Red. So today in this particular video lecture, we'll be discussing about the macrolide. So if we discuss about the macrolide first, so there is a ring that is there in the structure of the macrolides, which is what? The macrocyclic lactone ring. Okay, so this particular ring is that there in the structure of the macrolide. If we talk about the functionality of the macrolide, that how the macrolide is going to inhibit the particular bacteria, so it is quite similar to the tetracycline and the chloramphenicol. How so? Because we know that the tetracycline and the chloramphenicol were inhibiting what? They were inhibiting the protein synthesis. Okay, so in the similar manner, the macrolide is also going to inhibit the protein synthesis. Okay, so that's what we are going to discuss that too in the mode of action, where we will be discussing about the mode of action of the macrolides, right? So moving towards the classification of the macrolides. So if we talk about the classification of the macrolides, so it could be classified into the three. First one is the macrolides, second is the azolide antibiotics, and third one is the ketolide antibiotics, right? In the macrolides, there is what? The older macrolides and the newer macrolides. Okay, if we talk about the older macrolides, so the very first drug is the erythromycin, which is also a prototype for this class of the drug, right? Now, from which particular thing the erythromycin is going to be obtained? It is going to be obtained from the Streptomyces erythraeus. Okay, so the next is the spiromycin, which is obtained from the Streptomyces ambofaciens. Next is the oleandomycin, which is obtained from the Streptomyces antibioticus. And there is one derivative for this particular oleandomycin, which is the trolindomycin. Okay, it's the derivative of the oleandomycin. So the next drug is the tylosin, which is obtained from what? Which is obtained from the Streptomyces fridei. If you will recall that there is a drug which you had studied in the aminoglycoside, which is the neomycin. Okay, so the neomycin is having the same source as that of the tylosin. The neomycin was also obtained from what? It was also obtained from the Streptomyces fridei, right? Similarly, the tylosin is also going to be obtained from the Streptomyces fridei. Means the source is the similar for both the drugs, but the class of the drugs are different. One is the macrolide, second one is the aminoglycoside. Okay, so the last drug for the older macrolide is the tilmicocin. Okay, this drug is given through the subcut route. If we talk about what's the functionality of the oleandomycin, tilmicocin, and the tylosin is, so all these three are used as a feed additive in the poultry. Okay, if we talk about the newer macrolides, so the newer macrolides are what? Roxithromycin and clarithromycin, right? If we talk about the azolide antibiotics, so very first drug is the azithromycin, quite famously used in the humans also, and next is the telithromycin. Okay, talking about the ketolide antibiotics, so the drug that is there in the ketolide antibiotic is the telithromycin. Okay, so let me move towards the mode of action. So if we talk about the mode of action of this particular drug, okay, so this is what? The cell wall, right? This is the cell wall. Okay, from the cell wall, this particular macrolide, say M is the what? Macrolide. Okay, so this macrolide is going to penetrate the cell wall through an active process. Okay, it is going to enter the drug enter the bacterial cell by the active process in which the ATP is required, right? So when this macrolide is going to enter the premises of the bacterial cell, this is what? The bacterial cell. Okay, so if we recall, it is also going to inhibit what? It is going to inhibit the protein synthesis, right? It is also going to inhibit the protein synthesis, right? So this is what? Our mRNA, right? This is the 50S subunit, and this is what? The 30S subunit. Okay, now this particular macrolide is going to attach where? It is going to see the 50S subunit, okay, is further formed by what? It is formed by what? 23S and 5S ribosomal RNA. Okay, Means the 50s subunit of the ribosomal complex is formed by what? It is formed by the 23s ribosomal RNA and 5s ribosomal RNA. Okay, so this macrolide drug is going to attach, see, this particular 50s is formed by what? It is formed by what? 5s ribosomal RNA, right? And 23s ribosomal RNA, right? Now this macrolide is going to attach where? It is going to attach at the 23s ribosomal RNA of the 50s subunit. Okay, so the macrolide is going to attach where? At the 23s ribosomal RNA of 50s subunit. Okay, so that's the site of attachment for the macrolides. Okay, on the 23s ribosomal RNA of the 50s subunit. Okay, I hope this particular thing is clear, that where the macrolide is going to attach. Right, now we all know that the function of the tRNA begins, right? So the tRNA is going to carry what? The amino acid. Okay, say this is the acceptor site. Okay, this is the terminator site. Okay, so this particular tRNA will be going to come. Okay, so the first tRNA will be going to come at the site A. Okay, so this is the tRNA that attached at the site A, right? So what happened? The macrolide, what's the purpose of the macrolide is, so macrolides also inhibit the peptidyl chain elongation. Okay, likewise there that was in the chloramphenicol, right? In the similar manner, macrolides are going to also act by the similar fashion. So what macrolide is doing, see, consider there are two tRNA. Wait a second. There are two tRNA, okay, which is carrying methionine, okay, methionine. And second tRNA is carrying cysteine, okay. So what happens? The very first tRNA, this tRNA is going to attach at the acceptor site having the methionine, right? Now for the next tRNA which is carrying the cysteine, this particular tRNA should getting forward and should be releasing the methionine for the elongation of the peptidyl chain, right? And this particular tRNA should leaving the particular ribosomal subunit, right? So what macrolide do? The macrolide inhibit the translocation of tRNA from acceptor region. Okay, from the acceptor region, the translocation of the tRNA is going to be inhibited by the macrolide. So if there won't be any translocation of the tRNA, okay, in the ribosomal complex, so obviously the elongation of the peptidyl chain would be affecting, right? So that's how the macrolide is going to affect the protein synthesis. What macrolide is doing? So first of all, the macrolide is going to attach at the 23s ribosomal RNA of the 50s ribosomal subunit, right? Means the macrolide is going to attach. Please do not confuse, because the 50s subunit has been formed from what? The 23s rRNA, okay, and 5s rRNA, okay. So the macrolide is going to attach at the 23s ribosomal RNA of the 50s subunit, okay. So after the attachment, what the macrolide is doing, the macrolide is inhibiting the translocation of the tRNA from the acceptor site, okay. Means the tRNA that had already attached at the acceptor region is not moving forward and not giving a space for the next tRNA to attach at the acceptor site, okay. So if the next tRNA is not going to attach at the acceptor site, obviously there won't be any elongation of the peptide chain, okay. So if there won't be any elongation of the peptide chain, then it will lead to what? It will lead to inhibition in the elongation of the peptidal chain, ultimately lead to the inhibition in the protein synthesis, right? So that's how the mode of action of the macrolide is. So you can also look over here that the macrolide is going to enter the bacteria through the active transport, and it is going to bind to the 23s of the 50s ribosomal subunit. Then it will interfere with the translocation, and the elongation of the peptide chain is going to be inhibited, right? And there will be premature termination of the peptide chain, leading to the inhibition of the protein synthesis. And I had told you that too, that the same site of attachment for the macrolide, for the chloramphenicol, and for what, your lincosamide, all three are acting at what, 50s ribosomal subunit. Okay, so they shouldn't be given together. So that's what you should remember. Now coming on to the mechanism of resistance. So the mechanism of resistance is quite similar to the previous drugs that we had discussed already, that either the drug resistance could be obtained by decreasing the permeability of the macrolide, right, either by the inactivation of the macrolide or through the efflux of the macrolide, means the macrolide that had already entered the premises of the bacterial cell. So what we can do, we can just expel that particular macrolide out of the bacterial cell to have an resistance towards this particular macrolide class of drug. Okay, or either there could be what, the methylation of the 23s ribosomal RNA that is there in the 50s subunit. Okay, so if there would be the methylation of the 23s ribosomal RNA, okay, if there would be what, the methylation of the 23s ribosomal RNA of the 50s subunit, it will lead to the resistance towards the macrolide, right? Now the most common resistance mode is the plasmid mediated, and that too was similar in the chloramphenicol also, okay, due to the production of what, chloramphenicol acetyltransferase, right? Now coming on to the antimicrobial spectrum. So it is a broad spectrum drug, okay, it is a broad spectrum drug and more active towards the gram positive. Okay, it is mainly effective towards the gram positive, whether it is aerobic and anaerobic, both. Okay, and if we talk about, it is not that much effective against the gram negative, although there are some strains of the Pasteurella, Haemophilus and the Neisseria which are effective from the macrolides, right? And there the macrolides are also effective towards the mycoplasma, mycobacterium, chlamydia and the rickettsials, right? But it is also not effective against the protozoa, virus and fungi, as similar to that of the chloramphenicol. Okay, so the chloramphenicol was also not able to just have an activity against the protozoa, viruses and the fungi, right? So if we talk about the pharmacokinetic property of the macrolides, right? So in the pharmacokinetic property of the macrolides, so first of all you have to understand that the macrolides are generally effective at the basic pH or the alkaline pH, right? So obviously if certain drug is acting more efficiently in the basic pH, right? If a drug is efficiently acting at the basic pH, so obviously it is quite prone to damage or to get destroyed in the acidic pH, right? So we have to formulate those drugs such that they are gonna not be destroyed by the acidic pH that is there in the GI tract, right? So that's why we are going to prepare certain formulations or certain salt of the drugs such that they become acid resistant, okay, such that they do not get destroyed that by the acidic pH of the GI tract, right? So that's why the erythromycin is formulated by the salts which are acid resistant. Likewise, erythromycin stearate is there, erythromycin acetate is there, erythromycin lactobionate is there. Okay, these three salts are acid resistant, right? And they get readily absorbed whenever they are given orally. If we talk about the macrolide are more active at this pH 7.8, okay, and the effective pH should be 6 to 9, okay, for the action of the macrolide. So the means the efficient action is obtained at the pH 7.8, okay, and the macrolide are active at the pH 6 to 9, right? And but if the pH fall below the 4 or the pH will be more than 10, okay, so the activity of macrolide reduces, right? You should remember this particular segment, that if the pH will fall below the 4 and or it will be going to increase more than 10, then the activity of the macrolide is going to reduce, and the highest activity that has been obtained by the macrolide is at the pH 7.8, right? And the next thing is the, obviously I had told you that if something is ionized, right, absorption is less. That you had studied in the pharmacokinetics also. Okay, and if something is unionized, right, absorption is more. Okay, so in the similar fashion, okay, at the acidic pH, the macrolide tends to what? Tends to just ionize themselves. Okay, if a certain drug is going to ionize, obviously it won't be going to absorb efficiently. Okay, so that phenomena is known as ion trapping phenomena. Means certain drug is getting ionized. Okay, if certain drug is getting ionized, so it won't be just absorbing to the blood circulation to reach the ultimate targeting tissue, right? Means that particular drug is, see, for an example, this is your stomach, right? This is what? Stomach, right? If I say the macrolide is there, which is not coated by the acid, not coated by what? Acid resistant salts, right? So this particular macrolide is going to what? This particular macrolide is going to ionize, whether in the positive or the negative. That's not the concern currently, but it is going to ionize. So what happened? The macrolide ionized, right? So it won't be going to absorb in the blood circulation. A certain drug is ionized in the current situation. Okay, because the macrolide is currently ionized form. Okay, because the absorption is more for the unionized form and the ionized form is not absorbed, right? So the macrolide is going to be trapped within the stomach walls, right? That's why this phenomena is known as ion trapping phenomena. Due to the disturbance in the pH, the macrolide is going to be ionized, right? If a certain drug is going to be ionized, it won't be getting absorbed into the circulation. So it would be getting trapped into the lumen of the organs, right? So that's why it is known as the ion trapping phenomena. Okay, I hope it is clear, right? If we talk about the ruminants, there is erratic absorption in the ruminants too. In the case of the horses and rabbits, there is a severe diarrhea that has been obtained due to the macrolide when the macrolide is given orally, due to the increase in the activity of the motilin receptor that is there in the intestine, right? If the activity of the motilin receptor is going to increase, what it will lead to? It will lead to rapid peristalsis, right? Rapid movement, right? Rapid peristalsis would be there of the intestine. If there would be rapid peristalsis, it will lead to what? It will lead to diarrhea. Okay, so that's why the horses and rabbits aren't prescribed the macrolide orally. Okay, I hope this is clear. And it is widely distributed into the tissue, but it won't be getting absorbed into the CSF until and unless there is a situation of meningitis. Okay, that is similar to that of the penicillin. And the ability of the macrolide is there that they can accumulate within the macrophages and the leukocytes, right? If we talk about the plasma protein binding affinity, it is 70 to 80%. And the concentration of the macrolides are more there in the milk than that of the plasma. That's why it is famously used in the treatment of the mastitis, right? If we talk about the metabolism, so metabolism occur in the liver and excreted through the bile and urine as well. If we talk about the major route of excretion, it's the renal excretion. Okay, so what happened also as similar to the chloramphenicol, what the chloramphenicol was doing, it was inhibiting the cytochrome P450, cytochrome P450, right? It was inhibiting the cytochrome P450, right? So obviously if certain drug is going to inhibit the cytochrome P450, what it will lead to? It will lead to just accumulation of the drug that are going to be metabolized by that particular cytochrome P450 enzyme, right? If a certain drug is going to be accumulated, okay, I had discussed this concept in the chloramphenicol also, that if a class of drug is going to inhibit the cytochrome P450, right? So that cytochrome P450 is responsible for the metabolism of several class of drug, right? If this particular cytochrome P450 is going to be inhibited, what it will lead to? It will lead to the accumulation of the drug that are going to be metabolized by the cytochrome P450. Okay, so that's why the drugs that are going to be metabolized by the cytochrome P450 are not prescribed by the drug along with the drug which are inhibiting the cytochrome P450, because it will lead to the accumulation of those drugs and ultimately lead to the toxicity. That's the also an adverse effect of the macrolides. Okay, so if we talk about the adverse effect, right? So there are several adverse effects that you can notice. So the very first is the with the erythromycin, because the erythromycin acetylate salt may lead to the cholestatic jaundice. Okay, if there would be cholestatic jaundice, so obviously a drug is in a hepatotoxic. If we talk about the clarithromycin and the erythromycin, what they do, they will lead to the prolongation in the QTC interval, and tacit despontis can be observed. You had studied this term in the cardiac pharmacology, right? If not, please refer that portion once, right? And the pain and swelling can also be observed at the site of injection. Hypersensitivity is rarely seen. And if we talk about the two drugs, which is the tylosin and the telmocosin, okay, so both these drugs show what? Both these drugs show the cardiovascular toxicity. Okay, and what happened in this particular scenarios? There are tachycardias, myocardial infarction, and decreased cardiac contractibility can be observed by these usage of these drugs. So the tylosin show these symptoms in the cases of the dogs, while the telmocosin is contraindicated in the pigs due to the similar clinical signs, right? And the rosebudding is a toxic effect that is seen in the pig by the usage of tylosin. Please note this point. It is important that the rosebudding is a toxic effect that is observed in the cases of the pig due to the usage of the tylosin. And horse are also susceptible due to the activity of motilin receptor is increased, right? That's why horses are more susceptible to the GIT disturbance as it lead to the diarrhea, right? Talking about the drug interaction. So if we talk about the drug interaction, I had told you this point already, that the chloramphenicol, macrolides and the lincosamide are having the same site, which is the 50s subunit, so they should not be given together, right? And I had discussed this point also, that the macrolides are inhibiting the cytochrome P450. What it will lead to? It will lead to the inhibition of the biotransformation and the metabolism of the drugs that are going to be what? That are going to be metabolized by the cytochrome P450. But ultimately it will lead to the accumulation of those drugs that are going to be metabolized by that particular cytochrome P450. Okay, if there would be accumulation of those drugs, then it will lead to the toxicity of that particular drugs, right? For example, the warfarin, carbamazepine, theophylline, and methyl prednisolone. Okay, I hope this particular part is also clear. Not talking about the clinical usage of the macrolide. Okay, if we talk about the clinical usage of the macrolides, so they are good alternative for the penicillin, because penicillin was also mainly effective against the gram positive as similar to the macrolides, right? So it is a good alternative for the individuals which are not responsive against the penicillin. Okay, if this certain individual is affected from the gram positive, and if that particular individual patient is not responsive towards the penicillin, then macrolide could be a good alternative for that particular individual, right? It is both used for the local and the systemic infection, right? And it is effective against the respiratory tract infection, bronchopneumonia condition, metritis, mastitis, and enteric infection. If we talk about a slide about the all the drugs that we had discussed, so the erythromycin is there in the acetylate and the stearate salts, and it is also a drug of choice for the Campylobacter and the Rhodococcus in the cases of the foals. If we talk about the olindomycin and trolindomycin, they have special activity for the staph and the strepto, okay, as similar to the erythromycin, okay, because the action is similar, because the erythromycin is a prototype drug, right? And it is also added as the feed additive that I had told you in the starting itself in the classification. Now talking about the spiramycin, its action is similar as that of the erythromycin, and it attain the high concentration in the body fluids, okay, and it is a drug of choice for the CBPP. CBPP is caused by what? It is caused by Mycoplasma mycoides subspecies mycoides, okay. So it is quite effective against the CBPP disease. That's why it is a drug of choice for the CBPP. Okay, now moving forward, for the gram negative and the gram positive, for the gram positive. So if we talk about, it is also effective for the gram positive and the mycoplasma infection, as I had told you. Okay, it can also be used to treat the toxoplasmosis in the ewe, and if we talk about, it is also effective for the poultry in the cases of the chronic respiratory disease. Swine dysentery could also be treated by the sparamycin, and ovine rickettsial keratoconjunctivitis could also be treated by the sparamycin. Talking about the tylosin, so tylosin in the cases of the cattle, it is used for the treatment of the pleural pneumonia, foot rot, metritis condition. In the cases of the swine, it could be used for the pneumonia and the erysipelas condition. Dogs and cats could be treated with the infection of the respiratory tract infection, urinary tract infection, leptospirosis, and otitis externa. In the poultry, the CRD means the chronic respiratory disease could be treated. Infectious sinusitis in the cases of the turkey could also be treated, right? But it shouldn't be given to the poultry birds that are there reared for the consumption for the human, right? Because the eggs that are there are going to be affected by the particular tylosin, right? So if we talk about the telmocosin, it is a semi-synthetic macrolide, okay, effective for the bovine respiratory disease that is caused by the Pasteurella hemolytica and the mycoplasma as well, right? It is also effective against the gram positive, but it is not given through the intravenous route because it could be fatal, right? And it should be given slow IV, right? It shouldn't be given through the rapid IV route, right? Talking about the swine, horses, humans, and other primates are quite sensitive for the toxic effect of the telmocosin, right? And it is not effective against the lab animals, okay? And it is used as a feed additive. I had told you that too earlier in the classification only, to prevent the cases of the actinobacillosis, mycoplasmal infection, and the Pasteurella, and that's what it was about the telmocosin, right? Talking about the clarithromycin and the deoxythromycin, which is the newer macrolides. These are the semi-synthetic derivatives of the erythromycin, okay, and these are there to treat the respiratory tract infection, otitis externa, sinusitis, and the skin infection, and having the similar spectrum as that of the erythromycin. Talking about the azithromycin, so it have a good ability to concentrate itself in the leukocytes and the macrophages, okay, because it could attain a high concentration in the intracellular conditions, right? In the intracells, right? In the inside the cells, that's what's mean by the intracellular concentration is high for the azithromycin, right? That I had told you in the pharmacokinetic property also, that the macrolide have a tendency to accumulate within the cells, okay. So that's what about the macrolides. So talking about the lincosamide, why I'm taking the lincosamide along with this particular segment, because the lincosamide is quite similar to that of the macrolides, right? So if we talk about the lincosamide, so the lincosamide is going to be obtained from the Streptomyces linconensis, right? And it is what? It is a monoglycosamine antibiotic which could be given through the oral route, through the intravenous route, and through the intramuscular route, okay. It is a bacteriostatic drug. The macrolides were also a bacteriostatic drug, right? And the mode of action is also same as the macrolide. And if we talk about the lincomycin, it is readily absorbed orally but completely absorbed, okay, through the intramuscular site. If you are going to give the lincosamide through the IM route, then it is going to be completely absorbed into the blood circulation. If we talk about the drugs of the lincosamide, it is going to be widely distributed throughout your body and in the skeletal muscle as well, right? Along with the distribution in the soft tissues, but cannot penetrate the blood-brain barrier. Okay, these are largely metabolized in the liver, and the metabolites are going to be excreted through the urine and the bile, as similar to the macrolides, right? That's why I'm saying the lincosamide are quite similar to the macrolides, right? If we talk about the spectrum, these are active against the aerobic gram negative, and these are also active against the gram positive bacteria, including the penicillinase producing staph and the streptose, right? It is also effective against the Clostridium tetani, Clostridium perfringens, erythropoiesis, actinomycetes, nocardia, and some strain of the mycoplasma and Bacteroides fragilis. Right? If we are going to discuss about the clinical usage of this lincosamide, so the lincosamide is going to treat the infection that are related to the respiratory tract, skeletal muscles, skin, joint, and adjoining tissues. Okay, in the dogs and cat. Staph and strepto infection could also be treated by this particular lincosamide class of drugs. Okay, these are also can be used as the macrolides were also able to treat what? The pneumonia condition. So similarly, the lincosamide is also able to treat what? The pneumonia in the pigs due to the mycoplasma. Right? They are more active at the alkaline pH in the similar fashion to the macrolides, because the macrolides were also effective at the most effective at the 7.8, and the range varies from 6 to 9. Right? That's what the pH was. Right? If we talk about the adverse effect, so there is one most important adverse effect in the lincosamide, which is the pseudomembranous colitis in the cases of the horse. You have to remember this particular thing. This is important, that which particular class of drug lead to what? The pseudomembranous colitis in the horses. This is the lincosamide. Okay, I hope this particular part is clear, and no serious organ toxicity is there and may cause the GIT disturbance. Okay, pseudomembranous the pseudomembranous colitis can be treated by the vancomycin, okay, not for the neonates, okay, due to the poor metabolizing ability. If we talk about further about the clindamycin, it is what? A semi-synthetic derivative of the lincomycin, and differ from it by having a substitution of a chloride atom, okay, for a hydroxyl group. Okay, there is a substitution of the chloride atom for a hydroxyl group. Okay, and it is good from the lincosamide in three aspects, as it is having a better absorption, it is having a less side effect, and it is more potent. Okay, so the spectrum is quite similar to the lincosamide. Right, it is all similar to the lincosamide. So that was all about the macrolides and the lincosamide. So thank you everyone.